Good morning, everyone, and welcome to another session of iPros TV. We're really excited about how this platform is evolving. We're getting a lot of positive feedback from our agents on some of the content that we've had so far. So we're really excited about developing new content. This is a new concept that's going to be ongoing. We're planning to have multiple sessions every month and storing those on our website. So more to come on where you can access these sessions. My name is Juan Gallardo. I'm the Chief Executive Officer of iPros Insurance Professionals. For those of you that we already have an established relationship, you probably wonder why I'm always introducing myself. You're probably asking yourself, well, we know who you are, Juan. I'm really excited about our expansion. We have new agents coming on board every month. We have agents online right now from California, Arizona, Colorado. So we're really excited about our expansion, our new partners. You are our partners. iPros was established and continues to go with and through our agents. So we really appreciate your support. Today's AEP Readiness session is one of a series. Today we're going to be going over a little overview on our electronic enrollment platform. As you know, we started with our brand Medicare Shop and Compare, CMS approved, and we've now transitioned to Health Plan Cart for strategic reasons. Medicare Shop and Compare kind of narrowed our market only to Medicare. The new Health Plan Cart concept not only allows us to market our Medicare products, but we're looking at expanding it beyond Medicare into the IFP market, specifically cover California, the federally facilitated marketplace through healthcare.gov. So more to come on that. But today's session is to concentrate about Medicare. So with that, I want to log into our Medicare Shop and Compare system as it stands today. As a friendly reminder, for those of you that are enrolling individuals for an 11-1 and 12-1 effective, you're going to be using the Medicare Shop and Compare tool. Effective 1/1/2022, you're going to move into the Health Plan Cart platform for your enrollments. So I just want to reiterate that. We've had some questions, some confusion. I apologize about that. I think we needed to send out a little more communication, but this is an opportunity for me as well to remind you why we're transitioning to the new system and where to access, whether it's an enrollment for this year or for 2022. So I'm going to go here and share my screen real quick. While I'm doing that, I encourage you to use the chat box to post your questions, and we will have a Q&A session at the end. So I invite you to type in your questions. As you can see here on the screen, and we do have our technical team here with us today, so I'm just going to check in with them real quick. They can see my screen. Thank you. So again, friendly reminder, Medicare Shop and Compare for this year, you plug in your username, which is your NPN number. While I'm doing this, if you're asking yourself, why am I not set up on this system? I invite you to email us at connecture@iprosteam.com, Rodrigo. Is that correct? If you can please do me a favor and type that in the chat box. I encourage you to send an email. Once again, if you're asking yourself, why have I not seen this system before? Make sure you email us at that email address so that we can go ahead and get you set up here. Awesome. So this is what your system's going to look like as it stands today. Again, for 11-1, 12-1 effective. If you haven't gone in there, I highly encourage yourself to familiarize with your account. Go into your this is the dashboard that first pops up when you go into our system. It's very important that you hover to the top right of the page under your name. I'm using my actual account, and you'll see your respective name here in this section. When you click on this, click on Account Overview. When you click on Account Overview, scroll down. And what you'll find is a list of all of your carriers. It's really important that you go in there, make sure that all your carriers are listed. We have had some inbound calls from agents that are starting to quote during this AEP period, and they're noticing that some of the plans are not appearing. This could be for multiple reasons. One is you may not be completely certified. We've had some agents with specific carriers that have multiple modules. you walk away with the impression that you're fully certified, but you may be missing additional modules. So it's important that you focus by carrier and make sure that you are dotting the I's and crossing the T's when it comes to all the certification requirements by plan. If you are fully certified, you've confirmed, then it could be a technical matter, and that's what our technical team here is responsible for. So it's important that you raise your hand, let us know so we can get you fully uploaded in the system.
If I may add something, Juan, one of the reasons that the agents could also not have those permissions added onto their account is because there's a delay from when the agent gets certified to when our contracting department sees the name of that agent in our agent's roster. So that could be one of the reasons. So there's a brief delay. It doesn't happen overnight where the agent gets certified and the very next day we can see it on our end. Mm-hmm. That's another reason. So if you are certified and you completed the certification, it doesn't hurt if they let us know that they completed that certification so we can keep an eye out for their name and then we can load them as soon as possible.
Thank you, Rodrigo, for that information. Let me take a step back here. The way I got to this particular screen is by clicking on your plans tab here on the top. As soon as you click tabs, you're going to be prompted to plug in your zip code. This particular case, we're going to use our West Covina, California zip code. As soon as I click into the system, you will get a feed of all the plans that you are currently appointed, ready to sell for. Once again, part of testing the system, part of making sure that you're fully operational when it comes to utilizing this platform is you'll notice here to the left, you'll see a listing of all the plans that you are currently certified for. These are my plan certifications. As the principal of iPros, I'm required to certify every year with each of the plans as an agency. So these are my agency appointments. You'll have your own individual producer appointments. You'll see them here to the left, all the carriers you contract with. So if you have a short list of one or two, and you know you're certified with 10 of our plans in the California market, for example, there is an issue. 90% of the plans that we contract with are all compatible with the Connector system. So it's something that you need to keep an eye out for. Another cool feature of the system is if you go here to the top and you see add non-licensed plan, if you want to broaden your search, depending on where you're at in your county or state, and you want it to pick up all the plans, because iPros does not contract with every single Medicare plan out there. Strategically, we contract with partners where we know we can meet our enrollment thresholds. Every single plan that we contract with have yearly requirements that we have to meet as an agency that can be as high as 1,000 enrollments a year that we need to comply with. So again, we don't contract with every single plan. If you find yourself in a situation where you want to broaden your search based on the client request, what you do is you click on add non-licensed plans. And then plans that either we do not contract with, or you just, again, want to broaden your search based on plans that are not available in the Connector system themselves because they're not contracted with Connector, the plan themselves. That'll broaden the search. So you can see here all of the plans that pop up in the LA County area. There you can see that. Rodrigo, do we have any questions that we can address regarding Connector? We might as well tackle those now.
Yes, we do. Sandra Martinez is asking, will we see 2022 plans here now?
Greetings, Sandra. Nice to see that you're on with us today. If you want to see the 22 plans, you're going to log on through the health plan cart. Same username, which is your NPN, same passcode, Rodrigo, that you use now with the current system.
Correct.
That will display the 22 plans. Let me log out here as a quick reference. If you're logging into the enrollment platform and you see the Medicare Shop and Compare logo, that's for November 1st of 2021 December 1st of 2021. This year, January 2022, and beyond, you're going to see the health plan cart logo. Very important. Great question, Sandy. Thank you. Any other questions?
No other questions at this time. Oh, actually, there's one more that came in. Christine Ringrose is asking, I'm noticing several 2022 providers not listed on my carriers list. Should I contact Jackie? Oh, actually, I can answer that question. Christine, if you can email us at connecture@iprosteam.com and then let us know which carriers you're missing, and then we can go ahead and load those into your account.
At iPros, we're continuously trying to provide different platforms to provide you with the support, different departments. I want to remind everybody that you have broker support at iprosteam.com. If you're not sure which department that you need to contact, whether it's Medicare, group insurance, individual family plans, really encourage you to email us at brokersupport@iprosteam.com. We also have a toll-free number of 1-800-250-3149. And I'm going to ask the team to plug that in the chat box so that you guys can take a note of that for future reference. But again, if you don't know which particular department to contact, once you submit or call the 1-800 number or send an email, that generates a ticket. That ticket then is distributed internally to make sure that question, that inquiry, that concern is addressed. So it's really good that you use the system because it allows us, again, to provide high quality support. And Christine, I'm putting myself on the spot here. I saw your email regarding the Aetna programs up in Northern California. So I promise you that I will reach out to you today. And thank you for being on the call with us on this iPros TV session, by the way. So just want to shout out there to Christine Ringrose. Now, moving on from our connector system, I want to jump over to this sheet. And I'm going to ask my technical team here, see if they can see this up on the screen. Pretty much on a weekly basis, very regular basis, I get the same question from our new agents is, where do I start? What do I ask? What do I do? For that reason, we've created our Medicare sales screening checklist. This is a tool that you can utilize to probe, to ask those right questions so that you can walk away and find the right plan for the consumer. We'll be providing this form to everyone via email post this session so that you can have it in your sales toolkit. We are in the process of developing, the final phase of developing a platform where you're going to be able to capture these questions in an electronic profile through our new system called iPros Connect, which is forthcoming. I know we've had multiple conversations around the launch of iPros Connect, but it just keeps evolving and evolving. It's becoming more and more sophisticated as we move along. And I think that I know that once this comes out to market, that to only the iPros agents, you guys are going to be really excited about this platform because it really ties everything together. So more to come on that. This checklist is something that, again, you can utilize to screen your members. I'm going to briefly go over it and we'll address some questions after I'm done. So we want to first capture the zip code. Why is this important? It ties into the connector system so that it picks up the plans for that respective zip code. And it ties into Medicare.gov as well. The zip code is also utilized to bring up plans. It's important to note that for those agents that live in very rural areas, sometimes not all the zip codes in those particular counties offer a Medicare Advantage options. They're so limited in their network that individuals are left either on Medicare fee-for-service with the option to get on some type of Medicare supplement plan, again, because of the rural area that they live in. So it is very important that you capture the zip code. You want to capture the county of residence. You want to ask if they're a Medicare only. And when we say Medicare only, there are individuals that only have their Medicare Part A and B. And there are those that, because of their income thresholds, will qualify for the Medicaid program. And those in the industries are called Medi-Medis, MEDI-MEDI, Medi-Medis. Familiarize yourself with that term. Very important population. because iPros is not an AEP only agency. We are a year-round agency because one of our specialties is working in the duals market through the providers. So it's important to find out, are you Medicare only? Yes or no? When is the effective date of the Part A and Part B? Very important, because based on that effective date of the Medicare Part A and B, then you can go into the enrollment periods, right? You have your annual enrollment period, you have your special election period, you have your initial enrollment period. For the duals, you have your special election period 1, special election period 2, special election period 3, and then AEP. We are going to have a session this month. My team doesn't know about it, but they're finding out now. The next session is going to be on the enrollment periods. We're getting a lot of questions around the enrollment period, specifically around the duals, because duals can enroll every quarter. So more details to come on the enrollment period. So one important reasons why to capture the effective Part A and B. Are they always going to be the same? No, they're not. There are individuals that work beyond the age 65 that get their Part A only because they have what they call creditable coverage. And then down the road at 66, 67, 68, 70, decide they're going to retire, then the B kicks in. So you'll notice that the A and the B don't match up. So very important to always hone in on the Medicare card effective dates. It tells a story. On the Medicaid, especially in the California market, and something that we need to educate ourselves as we're working, for example, in Arizona and Colorado, they have their specific Medicaid program. In California, it's called Medi-Cal. In the California market, we want to make sure to find out if that Medi-Cal is full scope or share of cost. And that basically means, or it will dictate the type of Medicaid coverage that they have. So important question to ask in any state. Are you a dual eligible? If they are, there are specific plans in the market for this population. They're called D-SNP plans, SNP plans. These plans are specifically created for the duals market. And then you want to ask if they've been diagnosed with end-stage renal disease at the time of enrollment. In the past, 2019, you couldn't enroll in an ESRD individual. You have to walk away. New legislation has gone through where now certain health plans offer an ESRD plan. So it's important to find out, do these individuals, or have they been diagnosed with end-stage renal disease at the time of enrollment? Another important question to capture. The next question you want to ask your client, what type of plan are they looking for? When I say what type of plan are they looking for a Medicare Advantage, which are traditionally an HMO? There are Medicare Advantage PPOs, by the way, but for the most part, they're all HMOs. Or are they looking for a supplemental plan, an open access plan? What determines which direction they head in? From my experience, those individuals that are looking for cost savings, those seniors that are looking to make sure that they're stretching their dollars at their time of retirement, will seek out a Medicare Advantage plan. And with the competitive market that it is, there are many Medicare Advantage plans with zero premium, I should say, and many zeros when it comes to the benefits. So very popular plan in the market. The other options that they have is a Medicare Supplement plan. A Medicare Supplement plan, these individuals have the means, have the revenue to be able to afford to pay a monthly premium. Okay. When we dive into the special election periods in our next session, we'll dive deeper into the Medicare Supplement plans when it comes to selecting a Medicare Supplement at the initial enrollment period when they're aging into Medicare. Because when they're aging into Medicare on a Medicare Supplement, they're guaranteed issue. These individuals get in automatically. So it's important that you educate your clients at the time of the initial election period about their options. It is a CMS requirement that you let them know, hey, you have access to a Medicare Advantage, but there's also the Medicare Supplement plan option as well. And if the client goes down the direction of a Medicare Advantage at that initial election period, they lose that guaranteed issue that they would have had during that IACP, the initial coverage enrollment period. So very important. We'll get into details on our next session, but something to think about. The next important critical question is, who's your primary care physician? This is key. Why is it key? A lot of times the primary care physician in all markets dictate where or what plan the individual wants to select. Not only the plan, but the medical group. So it's really important as you're putting the pieces of the puzzle together for your client that you collect the name of the primary care physician. Great practice from an agent perspective is to put in a call to the provider office, introduce yourself as an agent with iPros, that you have a client that you're enrolling that is an established patient of this clinic, and you want to verify which health plans they accept and what medical groups or IPAs, independent physician associations, they belong to. Because again, from a retention standpoint, it helps keep your client happy, and you make sure that when the patient shows up to the medical office, they're in the right plan, right? We see many cases where the patient shows up to the provider office and the provider office is not happy because they ended up joining in a medical group or IPA that has a lean specialty network, or just they're not happy with the service in general. So it's a wonderful practice for you to contact the primary care physician office. And as a result of that, I've seen case after case where they now want to engage with the agent. They want to know more of what you can do for them as an agent, especially if you're bringing on a new patient. In this particular scenario, the client is looking to you for guidance on finding a good physician in the community. Once you enroll somebody with that physician, it's another good practice to contact or even drop by now that things are opening up as a result of the pandemic. We know provider offices are closed. Now that things are opening up, I really encourage you to go into provider offices, introduce yourself as the local agent, let them know that you have a new enrollment for them coming effective November 1st, December 1st or January 1st. That most often than not leads to a deeper conversation around how you can become their agent of record. For those of you that are not aware, more than 90% of our production comes from provider offices, provider relationships. So this is very key to ask who your primary care physician. Another important question is specialist. What specialist are you seeing? This sheet allows you to capture the name of the specialist. Another important question, are you currently under treatment? This is a very critical question when you look at compliance or a potential sales allegation. It's always a great practice to ask for. If they're going through treatment, because you don't want to interrupt continuity of care, especially if the client indicates that they have a surgery coming up at the end of this month or the first week of November. That right there is a trigger. It's an alert, because if you enroll them in a plan that doesn't align with the current specialty that they're seeing or the current facility that they're going to, you just interrupted a surgery that they may have been waiting for weeks or months. So it's always key to ask, are you currently under any treatment? Are you scheduled for any surgery? That's where you see that question and you capture the date. This allows you to make the right choice. It's always a good practice to say to the client, look, you already have an authorization in place. You have the surgery that you need. Get your procedure done. Once you get this procedure done, we can go ahead and switch you over. Something else you can do is, again, contact the doctor's office specialist, let them know, keep them in the loop. If the client insists, I want to change, then you have the right to contact the providers and let them know that this is happening so that there's coordination of care there. The other important piece is prescriptions. This is important. You want to capture the name of the prescription, the dosage, and how often. I don't know, is Javier Montijo on the line with us? Did he join us in this session? He had a new Medicare client that he came in contact with yesterday, provided their Medicare IDs. The Medicare ID, they're in the process of getting enrolled. Very first client, but to his luck, this person takes 19 medications. So he couldn't have got a better client, right? With 19 medications that he has to review. this sheet is something that he utilized so that he can go ahead and make sure that he's capturing all the details and then plugging it into our Medicare Shop and Compare tool as it stands today and be able to find the coverage medication, right? Continue on the sheet. We have, do you make your own decision? This is another critical question because a lot of these individuals, a lot of these seniors that you're going to be in contact with most likely have a daughter, a son, or a family unit that has to be involved and should be involved in the process. So you always want to ask, do you make your own decisions? The client says, yes, I do. Proceed. The other part of this question is there may be individuals that have their authorized representative. They're authorized through a legal document known as a power of attorney. If there is a power of attorney in place, you are required to submit the enrollment along with a copy of the power of attorney that validates the signature on the enrollment form, because most likely this authorized representative is the one that's going to be authorizing this. I'm going to take a quick break here and just put my phone on non-vibrate. Some things we need to learn here as we continue to evolve here at iPros TV. So this is the presentation, the Medicare sales screening checklist. This addresses that question, where do I go? Where do I start? This is your first step. Like to open it up for any questions that we may have out there.
Thank you, Juan. Silly is asking if you can discuss ISNP.
That's the institutional special need plans. If that's what you're referring to, those are particular plans created for individuals that are living in a facility full time. One of our carriers, Brand New Day, offers institutional special need plans. Can you type in the question if she's referring to the institutional special need plans? Any other questions?
Yes, Laritza Solis is asking, will you be sending us this form via email?
Hello, Laritza. How are you? Yes, we will. I mentioned at the beginning of this particular session that we're going to be sending this to all our agents post this training. And we'll go back to C. Lee in regards to the institutional plans, if that's what you're referring to. Any other questions?
No other questions at the moment. We should just wait. Yeah, Celie said yes.
Yes, and one plan that specializes in that, Celie, is Brand New Day. Brand New Day offers an IASMP, again, institutional special need plan, and there's a special certification that comes with that plan. It is a very specialized plan for obvious reasons. These are individuals that are fully they live full time in some type of assisted living facility or just a number of different facilities that they have out there for individuals that have need of full-time care, for example, dementia. So we can definitely hold a session on that. I think that's a great idea to have something on IASMP because their plans like Brand New Day are always looking for specialized agents to help with that. So more to come on that. I'm going to move on now to this form here this part of this session, I'm sorry, tongue-tied this morning, which are events, marketing events. A lot of questions around marketing events. I've been in the industry now going on 30 plus years, and licensed agents since I started have always been leery, scared of the Medicare product because of it being very highly regulated. So I would agree that anybody coming in new to this industry may be concerned about their license. But I can tell you that even though it's a highly regulated industry, it's also very lenient. And when I say lenient, it's okay to make mistakes. During my career, managing both agencies, selling under the plan where I was employed, as well as captive agents, constantly working with CMS around sales allegations. There are substantiated sales allegations, unsubstantiated sales allegations. In my 7 years managing at a health plan level, we never got a substantiated claim where the individual or the agent was sanctioned or lost their license. I've never seen it happen in my 30-year careers. Why? Because CMS, as well as health plans, as well as iPros, offers what we call corrective action plans. If you make a mistake, and when you make that mistake, it's because there's a lot, the CMS understands, the health plan understands, we understand that there are a lot of layers, and you're going to slip, but it's an innocent slip, right? You forgot to file a particular event. You forgot to submit the application with a scope of appointment. Those are situations where there's a corrective action plan that could happen. When it's substantiated, for example, is if you're caught knocking on doors. We all know you cannot go to a senior living community and go door to door and ask, do you have Medicare? I don't want to talk to you. Those are just things that you're not supposed to do. If you stay within the norm, you should not be afraid of the Medicare product. Again, very lenient. If you made a mistake, corrective action plans are very simple, and it's a training and development opportunity. I always tell my agents that we're not sales people, sales individuals. We are educators. Our role is to educate, guide consumers about their Medicare options. In order to provide that education, that guidance to seniors, CMS has 3 types of events that you need to be sensitive to. And this document as well will be provided to our agents. The first event is a formal sales event. This is defined by CMS, by the way. A formal sales event, agent presents plan-specific information to an audience invited to the occasion. The other is an informal sales event. Agent offers info upon request only while at a table, booth, kiosk, or RV. What is the difference? In a formal event, you're mailing out invitations to a list of random individuals. You are at a restaurant and inviting people to come into your presentation. That is a formal sales event. An informal sales event is you are attending some type of health fair, some type of community event, and people are walking up to you. You're not soliciting them to come to, they come to your table. That's considered an informal sales event. I hope I defined that clearly. It's clearly noted on the sheet. 2 different types of event: formal, organized, invitation, sign-in sheet. You're there to enroll in a plan. Informal, you're attending an event where you know there's going to be a crowd, you know there's going to be traffic. For example, we had an agent I spoke to yesterday in Georgia who has a commitment with a swap meet for all of the AEP. Ask questions around what can I say, what can I not say. It'll be addressed here in this section of our AEP readiness. I would file that as an informal because that gives you the opportunity to enroll in the plan, right? I'm sorry, to talk about plan-specific information. So continuing with this section, let me just review my notes. We talk about where can we hold these events. I think it's important to note in regards to the provider outreach that we like to conduct here at iPros. It's important to note that the only thing you need to be concerned about is you don't want to be presenting to a beneficiary in an exam room. You don't want to be anywhere near an exam room with a beneficiary. That is a big no-no. Other than that, you have full access to the common waiting areas in a healthcare setting. This includes common entryways, vestibules, these are outdoor areas of a building, for example. The waiting room is a great place to set up. Hospital or nursing cafeterias, community or recreation or conference rooms. All of these perfectly acceptable for you to organize your event, right? So again, everybody will be given this particular sheet. Great reference guide for you when it comes to knowing what type of event am I organizing, informal, formal, educational. Another important topic to discuss when it comes to events is the registration of an event. Let me just scroll down here very quickly. Now, CMS requires you to file informal and formal events. Each individual carrier has their own submission guidelines. If you have an event that you want to file, you can email us at brokersupport@iprosteam.com indicating that you want to file an event. What you will receive is a template from our internal department where you are going to list the date, time, location, contact person, etc., so that we can then submit to CMS that you are going to be at this location during these dates or these time or times. This allows them the possibility of sending a secret shopper to your event. Nothing to be concerned about, nothing to be scared about. These are independent contracted companies. They're not actual CMS representatives. These are third-party vendors that have a contract with CMS to go out and spot check events. What's going to give you a red flag? When you have individuals that are asking in-depth questions that you know the common layman senior beneficiary is not going to know, right? If you have sophisticated questions being asked of you, either this person works for a health plan or they're a CMS secret shopper, or they're an actual agent, right? So you should be able to figure out, okay, this person could be a secret shopper. Again, I want to reiterate, nothing to be concerned about. You're not going to lose your license. They're just there to make sure that as you're interacting with the individuals, you're saying the right things. And when you're saying the right things, it means that you're not saying that you're going to get everything for free. Or you're highlighting a particular plan that plan ABC is the best plan. And that way no, you have to remain neutral. You have to remain open, full disclosure. So those are the things that you want to be sensitive to, right? So just again, to reiterate, for those of you that are planning to do events between now and the end of open enrollment, it's important that if you want to collect applications, you want to enroll on the spot, that you're registering it with the respective plan. You don't need to know the timeframes or requirements. Submit your request through brokersupport@iprosteam.com, and we'll guide you as to what the timeframes are for registering your events. So I'm going to, again, you're all going to get a copy of this. So don't worry too much about taking notes. I'm just going to give you an overview here, high level. I want to jump into do's and don'ts when it comes to giving your presentations. This is going to be a great reference guide for you. We're talking about an informal and formal event setting, correct? So let's talk about the do's. Under informal or formal, you can let beneficiaries approach you at an informal event. You can use sign-in sheets that clearly indicate providing contact information is optional. You can name all the products and plan types that you cover before starting. So if you have a room full of people, or if somebody approaches your table in an informal setting, it's okay to say that you're a Medicare certified agent, and that you represent all the carriers that you represent, and that you have the ability to cover a Medicare Advantage, Medicare Supplement, prescription drug plan, etc. You can only use carrier and CMS approved presentation and talking points. I love some of the enthusiasm of some of the agents that are joining iPros and they're developing their own material. I want to caution you, there's no need to reinvent the wheel. There's a lot of material out there that is already CMS approved, CMS compliant, that tell the message that you want to tell from an educator standpoint, from a guidance standpoint. So I encourage you only to use CMS approved material. You can distribute giveaways with your contact information on it. Again, you'll notice on each of these different tables, you'll notice a number right after the definition. That'll prompt you down into the document that this requires CMS approval, just to give you a heads up on what that means. You can give away promotional items that include plan name, logo, toll-free number, and or carrier website. Excuse me. You can provide refreshments or light snacks, excuse me, such as coffee, soda, fruit, or crackers. You can provide handout objective educational materials on Medicare Advantage, Part D, and other Medicare programs. You can distribute star ratings, information, summary of benefits, pre-enrollment checklist, and the multi-language insert with any enrollment form. I'm going to grab a little more water. Excuse me. I want to talk briefly about star ratings. I had a question from one of our Arizona agents around star ratings. A particular plan having, I believe it was a 3-star rating. These ratings are based on data. If you look at Kaiser Permanente, and they're obviously health quality measures, there's no doubt. But it should be something that doesn't deter you from feeling confident that all of the Medicare Advantage plans that are being out there provide quality care. Because you may have a doctor that accepts a 3-star rated plan that also accepts a 4 and a 5 rated plan. It's around data. It's around the health plan itself, the healthcare providers providing timely, accurate data that impacts these health measures that create the star ratings. From a consumer standpoint, yes, for those consumers that are well educated on how the Medicare Advantage plans work specifically and look at the star ratings as a quality measure, then that is going to be a concern. And that individual says, no, I only want to enroll in a 5-star plan. Same doctor, same specialist, same everything. So from a visual standpoint, that 5-star could resonate and say, hey, that's the plan that I want to be in. But again, I don't want you to steer away from 3-star rated plans because that doesn't necessarily translate that they're not going to get the best care possible. Just wanted to talk a little bit about that. You can collect lead cards and business reply cards. iPros offers CMS compliant request for information cards. If you don't have any, contact us to broker support. The number and email is listed there in the chat box for you to request those materials. You can freely give out your business cards to any attendee at formal, informal events, and you can arrange follow appointments on the spot. Let's talk a little bit about the don'ts. During your marketing events, offering health screenings or similar activities that could seem like or be used for cherry picking. So as you're collaborating with medical groups, you definitely don't want to set up next to the screening table, and you definitely don't want to make it a requirement for them to speak to you in order to get that health screening that you're offering in a health fair setting, for example. You want to keep it neutral, try to stay apart. And in those type of events, you want people to come to you. So at iPros, we offer branded tablecloths that clearly state if you have Medicare questions, we have answers. That will have somebody approach your booth to ask for more questions. We also have different types of table games that we're offering now. What do we call those tables that we ordered, guy? The Plinko. That's a little device where you can select your different promo items. And as it hits that promo item, you can give it away, and then that could start a conversation. But in those type of setting, you want somebody to approach you. You cannot require attendees to use a sign-in sheet, right? So if you're going to use a sign-in sheet, very important that it in bold letters, nice and large, optional. Continuing on the don'ts, you can't compare one carrier's plans to the other carrier plans by name without getting written consent from all carriers involved in the comparison or without having studies or statistical data to back up comparisons. Comparisons must be factually based and can't be misleading. I touched on that earlier. You can't say this plan is better than this one or this plan is the best. You got to look at them all in a fair level playing field. Let the consumer decide based on benefits, network, etc. You cannot discuss or cross-sell non-healthcare related products such as annuities or life insurance. Very important. This is something that is looked at very closely by CMS. If you're with a senior, again, I want to remind you that we're dealing with a vulnerable population, very much protected, very much supported. So we don't want to get into any trouble by offering additional products. Doesn't say you can't offer them, but it has to be on a separate appointment, completely outside of what you did or perform as a Medicare educational presentation, right? So you want to keep that separate. You cannot use absolute or qualified superlative. Help me pronounce that, guy. Superlatives. Thank you. My apologies. Again, the best, the only, the one that you neutral. Use contact information provided by the attendees for raffles or drawings for any other purpose. So we don't want to be collecting their home phone number, their contact number, their address in lieu of getting a prize, right? That's a big no-no. Offering or subsidized meals or a combination of foods and beverages that can make it seem that you're offering a meal. You can definitely offer at one of your educational events. We like to offer water and granola bars. That has carried us up to this point. Very inexpensive. And it's something that, based on CMS guidelines, does not constitute a complete meal. Where are we here? Require attendees to fill out a scope of appointment form or enrollment forms in lieu of attending, right? Collect enrollment applications unless the enrollee has a valid election period. And again, it's voluntary. Let's talk a little bit about cancellations. If you're filing formal and informal events, it is important because we know things change. Either from the organizer or venue standpoint, or you may have an emergency. It's always important that you notify the plans and iPros immediately if you plan to cancel the event. Why? Don't forget that we filed the event with CMS. We filed the event with the health plan. You may have a secret shopper both from CMS or a health plan secret shopper to come out. So you want to make sure you cover your bases. If you cancel the event, you need to notify them. And here in this document that you'll be receiving, it talks about best practices when canceling your sales events. If you cancel an event within 48 hours of its originally scheduled date and time for any reason, including zero attendance, that's important. If you're organizing an event, nobody has RSVP'd, you have the right to cancel the event. And you must do it at least 48 hours in advance of its originally scheduled date and time. Okay. Now let's look at the don'ts. Apologize on navigating this little system here. I'm sorry, not the don'ts. You should, I should say, submit the event cancellation to all carriers involved in your upline. Let the venue know out of common courtesy. You want to let the organization that you're working with know that the event was canceled. Be present and have a plan representative present on site at the original start time to let potential attendees know about the cancellation and provide them with plan information unless the cancellation is due to inclement weather. And remain or have the plan representative remain on site at least 15 minutes after the original start date. So this is a best practice. If you're canceling, some people may not get the notice. Some people aren't aware that you canceled. They'll show up as a courtesy. You need to have somebody there at least 15 minutes once the event starts to make sure they can greet anybody that showed up, right? And you must submit the event cancellation to all carriers involved in your upline. Let the venue know. I think we covered that, right? Tell potential attendees about the canceled event at the same way you let them know about the carrier, right? If you cannot, you must provide proof substantiated that all carriers were involved. Most important takeaway, if you're canceling, you want to make sure that you notify the carriers, notify iPros, of course, and then you want to be or have somebody be there on your behalf 15 minutes from the time it starts so that you can greet anybody that didn't get the notice that the event was canceled. We're at 9:51. We have about 9 minutes. I want to address some questions. If there's any questions on there, there's no questions. Okay. Briefly touch on educational events. We talked about formal, informal. In a nutshell, you can enroll on the spot. You can collect applications. You can collect lead cards. You can give promotional flyers that you have approved by CMS. So it's a proactive selling mode, right? Selling mode. Then you have your educational events. Your educational events do not need to be filed. And these events are generic events. You're not honing in on any particular plan benefit or plan benefits, right? You're not distributing applications on the spot. You're not collecting lead cards. It's educational only. These do not need to be filed. So no secret shopper situation here. That doesn't mean that you use this as a loophole to not have to file events. We encourage you, if you want to be selling on the spot, you want to go ahead and, from a compliance standpoint, regulatory standpoint, file. But there are opportunities where you can offer educational events, right? This can include faith-based organizations, community-based organizations, which include senior center, food banks, from an educational standpoint. You're talking about how Medicare works, Part A, Part D, Part D. In general terms, you can talk about Medicare Advantage plans. In general terms, you can talk about Medicare Supplement plans, but you can't get in a sales mode, right? You cannot tell the individual, well, fill out this referral card and I'll get back to you. The consumer has to be the one to initiate that selling conversation, right? So on this sheet, it gives you more detailed information in regards to your presentation, educational presentation. I want to talk about the educational do's and don'ts very briefly. In an educational setting, you can or do hand out objective and generic educational materials on Medicare Advantage, Part D, and other Medicare programs. You can answer question posed by the attendee. Different scenario, right, than the informal formal. You can actually engage people coming by. You can actually ask the question. Do you have questions regarding your Medicare benefits? In an educational setting, you have to stand back and let the consumer come to you. You can provide generic business reply cards to attendees. So we have acrylic stands that we can provide you that you can have at your booth, at your table, that has your information, your business cards. Let the consumer be the one to pick up that material. We use educational events a lot to establish relationships with the organizations that we're establishing a relationship with. For example, senior centers, food banks, it's a process. The seniors start seeing you there continuously. You build confidence that this is a trusted source, right? That's where we want to use an educational event to our advantage. You can give out your business card and contact info for beneficiaries to use to initiate contact. Includes completing and collecting a scope of appointment and schedule future marketing appointments. The don'ts: display a sign-in sheet or collect contact information such as name, addresses, phone numbers to the attendees. This doesn't constitute a permission to contact. Hand out applications or marketing materials that contain plan-specific information. Again, you want to have generic material on the table. iPros offers generic flyers for you that do not call any plan benefits out. As far as pricing or particular plans, it's generic. You want to be using generic material. Answer any questions beyond what attendees ask. Give away cash or other monetary rebates. Provide or collect enrollment forms. That's a no-no. Discuss any carrier-specific plan or benefits or distribute marketing plan materials. Give an educational presentation in a one-on-one situation. So you don't want to pull somebody to the side and have a one-on-one regarding their Medicare benefits. This is for open forum, people to approach your table and ask generic questions, right? So this brings us to the end of this sheet. Again, we touched on the Connector system. Really encourage you to take the time to log in, navigate the system, kick the tires. Let us know if you need additional support. Make sure all your plans are listed. If they're not, you need to contact Connector at iprosteam.com, or you can also contact broker support to request more information. We talked about the Medicare sales presentation checklist. Very powerful tool when it comes to asking the right questions so you can come back with the right plan. That's going to be distributed post this session as well. And then we dove deep on the types of Medicare sales events known to CMS as formal, informal, and educational. Nothing to be scared about when it comes to filing your events. I encourage you to file them when possible. Not to say that educational events are not great in the right setting, but formal, informal gives you that extra level of security that you're doing the right thing, especially when you run into a consumer that may want to be enrolled there on the spot. Any questions, Rodrigo, regarding this event? Sure.
Yes, Nahun Mancia is asking, what are camps classified as? Camps.
Nahun always has to ask those complicated questions to put me on the spot. Thank you, Nahun Mancia, for that question. I think it's based on the eye of the beholder, right? You can carry out camps in an educational platform or setting, I should say, where you have generic information at your table. As soon as you put out kits of a particular plan or plans, that now turns into an informal formal event because you're actually displaying sales material. So if you're going to do camps and you're going to do camps from an educational perspective, not approaching anybody, you really need to sit at your table, make sure you have the right call to action so people come to you. You can do that in an educational setting, in a camp. And when we say camps, let me elaborate on that. In our industry, camps could be setting up a table and a chair in the hallway of a medical building, in the cafeteria of a hospital, in a healthcare setting. That's considered a camp. The camp, again, educational, very generic material, zero plan information, not aggressive. People are coming to you. If you file informal camps, now you can, I don't want to use the word aggressively, that's inappropriate. You can actively, I should say, approach an individual that you feel may have Medicare and ask them, would you like more information regarding Medicare benefits? It's the annual enrollment period. Totally acceptable. Did I address that question, Nahun? If you can type in the chat box, I'd appreciate it. And continuing with that,
yes.
Wonderful. And just to elaborate a little further, it gives you that security, right? If you know you want to be proactive in generating leads, by all means, file the event. Completely acceptable. If you want to be a little more passive, educational all day long, they need to come to you. Rodrigo, do we have any other questions?
No other questions for now, unless they want to submit. We have like 2 minutes.
Okay. Well, I encourage you guys to send us an email at brokersupport@iprosteam.com if you have any further questions or you're shy or just not coming up at this time. We're here to provide you the support that we can. Email us at brokersupport@iprosteam.com. We'll address your questions. Again, our 1-800 number is posted there in the chat box for our broker support. That generates a ticket. We'll address any questions, whether it's commissions, whether it's need for kits, whatever it is related to helping you succeed in building your book of business. Contact us at broker support, I should say, at iprosteam.com. If we don't have any other questions, I'm sorry, we did get a question.
Yes, by Sandra Martinez. She's asking, using the system, after designating the physician, how do we attach a specific medical clinic? Example, which brand of Optum?
So she's referring to the...
Which branch of Optum?
Can Sandy, can you specify if it's using our Connecture platform? If it's using our Connecture platform, Rodrigo, I may need you to chime in here. It's been a while since I even navigated that portion of the system. Does the medical group, in addition to the primary care physician, can we select a medical group as well?
When you're finding or you're searching for a provider, depending on how many medical groups or doctors affiliated with, it shows you. So there's usually either a radio button if it has a full integration, meaning that it'll copy that information over from the provider search to Connecture. If not, you will have to copy and paste the name of the doctor and the medical group. So in the system, you do have two fields: one to enter the PCP name, and the other one to enter the IP or the medical group.
Okay. And when we use the acronym PCP, that's there may be new agents on the session. Primary care physician, another important term in this industry that we work in, a PCP, primary care physician.
Yes. So Sandy, hopefully that answers your question. And Naun is asking, just for my sanity, a Medicare 101 presentation would be educational in nature, right?
Medicare 101 would be educational in nature. Yeah, at something like that, you're high level, right? What Medicare consists of: A, B, C, and D. 80/20 coverage. What A's hospital, B medical. That type of presentation is completely acceptable and defined as an educational event. Great information or great question there, Nahun. Appreciated. I'd like to further research for Sandy on the medical group, and as soon as we have the answer, if we can distribute it to all the agents that attended today, is specifically around selecting the primary care physician and the medical group, because that's such an important piece, Sandy, especially when you're working with a partner like Optum. We definitely want to make sure that we're assigning it to the right PCP and, most importantly, to the right group, being that Optum has their staff model offices and then independently contracted physicians. And for those new folks to the industry, when you say staff model physician, this is your Kaiser settings. For example, where the doctor is an employee of the medical group or clinic, and it's a one-stop shop. You have your primary physician there. You have your specialist there, your ancillary, X-ray, lab, all under one roof. That's a staff model setting. Then you have your individual primary care physicians that operate their own community clinic, where all they do is primary care, and then they refer it out to those other services just for further education. Anything else pop up on our questions there? All right. Well, thank you guys for letting me off the hook on the questions. I appreciate it. As always, we appreciate you here at iPros. Encourage you to use the resources that we have to offer. Stay tuned for our next session. We're going to be talking or diving deeper on the enrollment periods, which include AEP, SEP, IEP, and most importantly, we're going to dive into the duals population, being that they have the SEP1, SEP2, SEP3, and the annual enrollment period, which the first quarter is considered SEP1, second quarter SEP2, third quarter SEP3, and then the fourth quarter AEP. And we're also going to dive in on LIS. How do you find out what their LIS levels are that impact the type of plan that you want to enroll them in? And also, we're going to talk about chronic plans in the next session that ties into these enrollment periods. For example, our diabetes plans. A lot of agents don't realize that somebody that's diagnosed with diabetes can enroll every month into a different plan. Chronic plans are exempt from any particular annual enrollment period. So more to come on the next session. We'll be announcing it via email so that you can log on to that session. Also, I encourage you folks to provide us feedback on what you want to learn from us. If there's anything that you particularly want us to hone in on, let us know. Gives us ideas for future content. So we need you to be proactive and letting us know what else we can put out there. This platform is evolving. Our team is working right now on ways that we can archive these sessions in our learning library so that you can easily access them to refresh your memory and just keep growing, right? This industry is about learning, about building your toolbox and building a strong book of business. So with that, we're at 10:05. We were 5 minutes over the session. Really appreciate you guys logging into this session, and more to come on our AEP readiness sessions that'll continue through the end of the annual enrollment period, which ends on December 7th. So wish you the best out there. Happy selling, and see you soon.